Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristen Jackson. Every week, my incredible and knowledgeable nurse practitioner, Rosalind Arp, and I share our combined 30 years experience to guide both men and women as they age. Listen as we dive into a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. These real-life insights are always rooted in solid scientific knowledge. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older.
Hi, everyone. Today's episode is all about skin and the changes we see in skin after menopause. So if anyone noticing dry skin, sagging skin, fine lines and wrinkles, loss of support of their skin, did you ever think that menopause could be the culprit?
Yes, even though aging is partly responsible for our skin changes, and that's mainly related to accumulated damage from sun exposure, changes that occur with perimenopause and menopause are also at fault for a lot of our skin changes.
If you've listened to us before, you know we can't do enough to educate women about the benefits of estrogen. Estrogen is responsible for the health of women's ovaries, our hearts, our brains, and bones, but you may not know that the estrogen is also critical for skin health. So when we lose our estrogen at the time of menopause, our skin really feels the difference, just like our brains, hearts, and bones do.
There's a large amount of literature on the positive effects of estrogen on our skin. The first place estrogen has a positive effect is on our collagen. Collagen is a main ingredient of our skin, and it provides the major support for skin. Human skin contains 14 different types of collagen, but 80% of it is type 1 collagen, while 15% is type 3. Collagen type 1 is more responsible for the strength of the skin, so as we lose this, we tend to see wrinkles and lines. Whereas collagen type 3 is more responsible for the elasticity of the skin, so without it, skin sags. Thin skin is a number one concern in postmenopausal women. It's sometimes described as transparent skin, and it's caused by a decrease in dermal collagen type 1, and it makes the skin more vulnerable to injury. There's an average decline of 2.1% of our skin's collagen per postmenopausal year, and a 1.13% decline of skin thickness per postmenopausal year. So this is not just aging. This decline is really only seen during the postmenopausal time. If women are treated with estrogen replacement therapy, skin biopsies show an increase in skin collagen of up to 5.1%. Estrogen therapy also results in an increase in collagen synthesis, both of the type 1 and type 3 forms.
So this means that the earlier in menopause that women start estrogen replacement, they will not only lose less collagen, they will also begin making more collagen. This way, they will see less of that thin, transparent skin that is so common in elderly women. Plus, the skin becomes more resilient due to the increase in type 3 collagen. That's something that elderly women notice. When their skin is so thin, the slightest little bump will make them bruise or bleed. By increasing skin collagen with estrogen, they make their skin more resistant to injury.
Yes, and in addition to skin thickness, estrogen also increases skin moisture. This helps combat dry skin associated with menopause. Estrogen causes increased mucopolysaccharides and hyaluronic acid in the dermal layer of our skin. Hyaluronic acids are these amazing molecules that can hold up to 100 times their weight in water, so they can pull water into the dermal layer, making skin more moist.
And this is why you see so many beauty products advertising that they can contain hyaluronic acid. It really plumps up the skin.
Yes, it does. But estrogen helps us to have natural hyaluronic acid, so we're less likely to need those products in the first place. Another reason for dry skin in menopause is the reduced amount of sebum produced. Sebum is our skin's natural emollient. It's a creamy substance that helps to lock in the moisture of the skin. As sebum production decreases with menopause, the skin becomes drier. But postmenopausal women receiving estrogen therapy have higher levels of sebum as compared with postmenopausal women not receiving estrogen therapy. Plus, estrogen therapy leads to a significantly increased water holding capacity of the stratum corneum, which is the most superficial layer of our skin. This tells us that estrogen plays a role in the stratum corneum barrier function.
With less sebum, postmenopausal women need to use additional products that repair the barrier function of their skin. But having a proper amount of estrogen helps to naturally maintain the skin barrier. And that's really our skin main function as a protective barrier to the elements and to keep too much water from leaving the skin.
That's right. And our next topic is wrinkles. Wrinkles form from a variety of factors, including genetics, sun exposure, and how we move and crinkle our face as we make expressions.
Mhm.
So, postmenopausal women have several risk factors for creating wrinkles. They have accumulated sun damage, and they're now facing the loss of estrogen. In a study of postmenopausal women using topical estrogen for 6 months, they saw decreased wrinkle depth and in the appearance of fine lines or crepey skin. This decrease, in large part, is due to estrogen's effect on collagen, as we previously mentioned, and in particular, estrogen's ability to increase the proportion of collagen type 3. I think the most important point of that study is that estrogen did not have the positive effect on women who were smokers. And that's likely because smoking has so many ways that it damages the skin. Plus, smokers have such poor blood flow to many organs, the skin included. So,
Mhm.
estrogen is not a cure all for the skin, especially if you're overwhelming it with a lot of negative factors like from smoking
Absolutely. Also, the sun.
and the sun,
Yes.
overwhelming it with smoking and sun. Oh,
So we've seen that estrogen has positive effects on all layers of the skin from the stratum corneum, which is a layer we can see, the outermost layer of the skin, all the way to the dermis where the collagen is produced. But it doesn't stop there, it goes even deeper. We also know that estrogen improves skin blood flow, and most of the blood vessels are located under the dermis. This is good for skin turnover and skin health in general, but it also results in less blotchiness of the skin. Underneath our skin and muscles are the facial bones themselves, and lack of estrogen is well known to be associated with bone loss. This includes the bone of our face, bone resorption around our eye sockets, resulting in a more sunken look to our eyes. Bone resorption around our nose results in a wider appearance to the bulb of the nose, and loss of bone at the temples results in a hollowed out look to the face. And this is where people get fillers.
exactly.
Yes. Once again, it would be important to start estrogen replacement well before bone loss has occurred to avoid these changes so we can avoid spending thousands of dollars on fillers.
So let's discuss some of the other things that we can do, in addition to estrogen replacement therapy, to prevent these postmenopausal skin changes. The first, for people of all ages, is limiting sun exposure. Other than the loss of estrogen at menopause, the sun is responsible for the majority of damage to our skin. It's critical to wear sunscreen daily, not just when we're laying out or tanning at the pool. For the average person, most of our sun exposure occurs walking to and from our car to go to work, or when we're out walking the dog or taking out the trash. Those are things we do every single day. That's why sunscreen is so critical. Now, of course, if you do plan to be in the sun, wear additional protection with hats and umbrellas in addition to just wearing sunscreen.
And you may say, well, my makeup has sunscreen in it, so I am protected. But for most makeup products, you would need to apply so much of it in order to get the protection you need. So we should really use a full amount of sunscreen to cover our face, our neck, and don't forget your ears. And then just a smaller amount of makeup as needed to your face.
Yeah, we don't want to be glopping on tons of makeup just because it has SPF 15.
Hmm.
The next most important thing for our skin is sleep. And we could do a whole hour on the benefits of healthy, good sleep, but let's look at some of the highlights. 1/3 of human life is devoted to sleep. And healthy sleep consists of recurring cycles of 90 to 120 minutes. During that time, we should have about 4 to 6 phases of alternating REM, rapid eye movement sleep, and non REM sleep. The data really support that poor sleep interferes with proper hormone production. So, nudge, nudge, that sounds just like menopause, poor hormone production. In a prospective study of 259 regularly menstruating women, their mean estradiol concentrations significantly increased by 3.9% for every additional hour of sleep that they got daily. One meta analysis showed that disturbed sleep is associated with a 46% increased risk of menstrual irregularity, once again, due to hormonal disturbance. Sleep is when our bodies do so much of the repair. So any sun damage that we receive during the day, our skin tries to repair itself during a good night's sleep. Collagen is also produced while we sleep. Sleep disturbance is reported by 54 to 58% of women who are in that menopausal time frame, aged 40 to 60. So estrogen replacement therapy, in addition to all these skin benefits we're talking about, also helps with improved quality of sleep, which will in turn lead to improved skin.
So it really is beauty sleep.
It is.
And it seems like 7 hours is the number to aim for. So we've already mentioned some of the poor effects, but smoking has been shown to negatively affect both collagen and elastin. It restricts blood flow to the skin, which decreases the nutrients coming in. It's an independent risk factor for wrinkles. Nicotine increases melanocyte formation, which leads to age spots and skin discoloration. And it's not just cosmetic. Current and heavy smokers have a higher risk of squamous cell carcinoma. And smokers with melanoma are 40% less likely to survive as compared to non-smokers. And a lot of our current aesthetic patients that are former smokers or current smokers also request for me to treat their smoker's lines, or which are the lines that happens around the lips. So these are reasons for you not to smoke.
And some people think there's no use in stopping smoking because, I've smoked for so long, so stopping now would be of no use. But within minutes of stopping smoking, nicotine levels drop to zero. Within just several days, carbon monoxide levels drop to those of a non-smoker. In just 1 to 2 years, your risk of a heart attack drops sharply. Now, some other changes, of course, will take longer. Decreasing your cancer risk can take from 5 to 7 years after you quit smoking. But you've got to start somewhere. By 10 to 15 years of not smoking, your risks of cancer and heart disease have dropped comparable to those who have never smoked.
That's great news.
Yeah. So even stopping, if you've smoked for 25 years, you can still do it.
Mm-hmm. Well, while estrogen, good sleep, and stopping smoking are all great options, sometimes there is skin damage that will need treatment. This is where medical grade products that contain antioxidants can help. Antioxidants protect the skin against free radicals, and they include vitamin B3, vitamin C, vitamin E, and CoQ10. Vitamin A derivatives are called retinols, and they increase the rate of cell turnover, keeping skin glowing and bright and improving blood flow to skin. Hydroxy acids are skin exfoliators, and they include glycolic acid, citric acid, or lactic acid. I would just recommend speaking with a skin specialist, since although many of these ingredients are in over-the-counter products, they often are not concentrated enough to really do anything.
Right. And while products are great, they do take time to show an effect. To really address skin damage, that's where we need to add procedures like laser resurfacing, light therapy to target brown spots and red spots, ultrasound therapy to stimulate collagen growth, and fillers that are made from hyaluronic acid to restore facial volume. Some patients also need neurotoxins like Botox to both treat and prevent wrinkles. So we'll put together a podcast specifically just on all of those skin services that you can do. Whereas today, we really wanted to focus on how menopause specifically affects your skin as you age.
And how estrogen replacement therapy can prevent it.
Just one more reason why we continue to tout the benefits of estrogen in menopausal women. Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and would be grateful for your positive review. We'll talk next time.